All right, so we have been talking about COVID-19 and disinformation, but now we are actually gonna talk to someone who has been experiencing it real time. We're gonna talk to people directly at the front line, basically someone who has been working in the hospitals and in the medical sector. Thank you so much for your time. It has been a hectic time the last months, so I'm glad I can speak to you briefly. Would you like to introduce yourself and what you're doing quickly?
Yeah, of course. Well, I work at the ICU, at a level 3 ICU in a Dutch hospital. I've been working there since about a year or so, and these past 2 months I've been working at the COVID unit. Yeah, and it has been a hectic time. It has been a very interesting time because it's a very new virus, and as everyone has heard, there's a lot of disinformation about that. So I'm happy to tell you what kind of impact disinformation has in the hospital.
You personally, are you all right?
Sorry?
Are you all right personally? Are you fine? It must be crazy times.
Well, yeah, I am all right. Yeah, there has been some moments that because that people died that impacted me because this virus it's very diverse. Like the one moment a patient is totally fine. He's good. He doesn't need a lot of oxygen, and then 5 minutes later. They get in a huge distress, and a lot of people, a lot of COVID patients die suddenly. Like they've been good, they've been getting better the whole week, and then in like 10 minutes they get in a huge distress. We turn them on their belly, on their stomach, and still they need a lot of oxygen, and then it's done. So those moments did impact me a lot.
All right, so we're dealing with a really severe virus. If I listen to you, and we have all seen that there's a lot of rumors and medical advices from everybody. Everybody became a doctor. Everybody became a virologist. How did that flood of information impact your work in the hospital? Did you feel that it impacted your work?
Yes, it did. Like normally when I talk to the family of patients, they don't know a lot of a certain medical condition. So everything you tell them, they agree. But nowadays, a lot of people are looking up information about COVID-19, or they hear a lot of information from family, from friends, from WhatsApp, from Facebook. And during those conversations with the family of those patients, they come up with certain treatments that has been proven not to work. Yeah. For example, like chloroquine or hydroxychloroquine. Suddenly they ask about that, or they ask about antibody treatments. It's all very experimental, but suddenly everybody is an expert.
So does that mean you're spending more time in comforting family and people and patients instead of being occupied with trying to treat them? Does that really impact your work, or how should I see that?
Well, it doesn't really impact it because we had a rule in our hospital that we the doctor has to talk with the family of the patients every 2 days. Normally, we do like a conversation with the patients, maybe once a week or once every 5 days, and every day with the nurse. But we did a new certain rule when it's a COVID-19 patient. We talk to the family every 2 days, and the family can call up the nurse every day. Okay. So we do talk a lot with the family, but it doesn't really impact the work because the virus is very severe. But the problem with the virus, is that the body, the patient has to clear up the virus in the body. It's all supportive treatments. We don't really have a treatment for COVID-19. It's all supportive.
Yeah.
We support it with oxygen and so on.
Okay, and have you been? You say there's an increase in communication with the family. Of course, there's an issue that probably the family cannot visit you, so this is by phone. And is it also the reason that you're talking more to them to make sure the family is better informed, or why have you been scaling up communication?
Well, normally the family comes to the hospital, sees the patients, and they see, oh, it's very bad. My father or my sister or my son he's very sick, and that has a huge impact on the family, and they know it's very severe. But if the family members can't see the patient, they just have to believe it on our words. And we have to tell them it's a very severe situation, but they can't process it. They just can't process how severe it is. So if they see and their father, their mother laying on their stomach with breathing tubes and all kinds of wounds because they've been laying there for 2-3 weeks, then they really process the situation. They really know, oh, it's very bad, and he might not survive. So, but now they don't see that.
So paradoxically, you're saying the sword cuts on two sides. On the one hand, you have a lot of false medical advices which give people the idea of treatment that needs like chloroquine. And then on the other hand, the fact that there's a lockdown and people need to keep distance actually also makes sure that they cannot see the real impact of the disease, which sort of makes them even less informed. Is that what you're trying to say?
Yeah, basically I am, yeah.
And then
yeah.
No, I just go on. Sorry.
No, because there, like a few months ago, there was a Belgian reporter. I don't even know which program that was. A Belgian reporter went to Italy, and he went to Milan, I think, and he took some footage of the hospitals over there, and you see like a whole room with like 6-7 patients laying on their stomach and getting ventilated, and those images did impacted us doctors. When we saw that, we realized like, oh, this is a very serious illness, and we have to take this very seriously. Because being laid on your stomach and being ventilated, we don't see that a lot. We normally see that like once a month or once every 2 months, that someone is that severe in need of oxygen. And during the COVID-19, we saw that every day. It was like a normal routine. Let's turn him on. Let's turn him back on. Let's turn him on the stomach. Let's turn him on the back. It was like a daily routine.
So the picture that the Belgian photographer shooted reflected your reality in the hospitals as well. There were many people on their stomachs.
Yeah, exactly.
And then if there's this issue with informing the family on a distance and a lot of medical advices going around and conspiracies, do you have any advice to people how they can inform themselves properly, and what would be the best way to deal with it if one of your family members is in the hospital?
Yeah, that's a very difficult question. Yeah, everybody needs like good sources of information, and the problem with this virus is that it's very new. So even our local government gave disinformation in the beginning. We used in the hospitals, it was protocol to use chloroquine, to use hydroxychloroquine, and now now the results see that there's no effect of chloroquine. So I could say, yeah, look up sources that the governments give you. Look up sources that like certified certified organizations give you. But if you don't know if that's accurate, because the information keeps changing about this virus.
Yeah.
But that I would give is still actually look up the information that certified medical organizations give you, and not for example a WhatsApp message or a Facebook message or Twitter.
Yeah. Yeah. And you said that even the local government had difficulties in finding the right information and giving a protocol which turned out later to be wrong. How did you deal with that? Did the medical sector inform the local government like this should not be the case, or how was that dealt with?
Yeah, how is it dealt with? Like the protocol kept changing. Like every when I wasn't working for a few days, then came back, suddenly the protocol changed completely. How is it dealt with? Yeah, we in Holland we have like the national coordination of the COVID-19. It's stationed at Erasmus MC right now, and they do listen to input from other hospitals. Like there was a hospital in the north of Holland in Groningen. Intensive care doctor said, "I'm seeing a lot of COVID-19 patients with lung emboli." Or my lines are all clotted with blood clots.
Yeah.
Then the national coordination organization they looked at it like let's look at all the patients because every hospital is collecting data on the patients and sending it to the national coordination in Erasmus MC. And they found out, oh, the blood of all the COVID-19 patients are more prone to clotting than other patients. And then the protocol changed into give these patients extra anticoagulation medication. So I do think like it's a new virus, but we learn a lot from it. Like every week, the protocol changes, and you can see that as a bad thing. Like, oh, they keep changing up the whole protocol. But I also see it as a good thing because you learn very quickly from it. Normally, it takes like months or years to learn something about a certain disease because you don't have a lot of those, a lot of patients with that certain disease. But we had a lot of patients in a very quick, very short period of time. So we learned a lot from it.
That's interesting. Thank you so much for these comments. And I would like to summarize with what I take from this is that this new situation leads to a lot of uncertainty, and this uncertainty can lead to requires the right information. It's a process in which we have to be able to learn, like the protocols, they need to be able to be updated, but please also make sure that you look into right medical sources and do not just go to Twitter or other media platforms and believe everything that is presented there. I want to thank you for your time. Keep up the good work. And yeah, stay safe. Thank you so much.
Yes, thank you. No problem.